Before starting the operation, you will have several tubes and lines placed. First, your anesthesiologist places several intravenous or IV lines. These will deliver fluids as well as medications to make sure you are comfortable and send you off to sleep. A pulmonary artery catheter is a long, flexible tube that is placed into a large neck vein and extends to the pulmonary artery. It provides a way to monitor your heart's function. Medications and IV fluids can also be delivered to your bloodstream through this catheter. The arterial line is inserted into an artery, usually in your wrist or groin. It records your blood pressure on the monitor. It also allows the transplant team to access samples of your blood without repeated needle sticks. Your anesthesiologist will monitor all your vital signs throughout the operation. Next, an endotracheal tube will be inserted through your mouth into your trachea, also known as your windpipe. It connects to a ventilator. It will breathe for you while you are under the effects of anesthesia. The nasogastric tube, or NG tube, is a long, flexible tube that is inserted either through your nose or mouth. It is then passed into the stomach. This tube keeps your stomach empty while you are on the ventilator. You will also have a urinary catheter placed. This drains urine from your bladder. It helps the doctors and nurses monitor your kidney function and your body temperature. The catheter is placed when you are asleep in the operating room. To begin the lung transplant operation, your surgeon will make an incision on your chest. The type of incision made depends on whether you're getting a single or double lung transplant. For a single lung transplant, your surgeon will make an incision on the same side of your chest as the lung that is being replaced. This is called a thoracotomy. The incision starts on the side of the mid-chest and goes around to the back of the chest, usually in the space between the fourth and fifth ribs. For a double lung transplant, your surgeon will make a clamshell incision. Cuts are made across the breastbone and extended under each breast area. Surgical cuts of ribs and sternum are necessary to access your lungs. Once the chest is open, the surgeon now has good exposure to the lungs. The lung that is to be removed will be deflated using a special breathing tube. At this time, you will be breathing with only one lung. Your surgeon may or may not choose to use the heart-lung bypass machine to help supply oxygen-rich blood to your body. Your old lung is removed and your new healthy lung is placed inside your body. If you are receiving a double lung transplant, this process is repeated on the other side. Chest tubes will be placed to remove drainage from your chest and help keep your new lung inflated. Your surgeon will then close your incision. Next, you will be taken to the Cardiovascular Intensive Care Unit, or CVC ICU, to start on the road to recovery with your new lung. There are risks associated with any surgery. Lung transplantation is no exception. Bleeding can occur during this operation. Depending on the quality of your lung tissue, there could be bleeding along the staple line. If bleeding occurs, blood can build up around the lung. You may have to go back to the operating room to have it removed. Poor lung inflation, or atelectasis, can develop after surgery. If you think of a brand new balloon, when you blow into it, the air doesn't fill the balloon evenly. Usually, the part of the balloon farthest from the hole inflates the slowest. Your lungs after surgery are like that balloon. Secretions accumulate in poorly inflated lungs and make it very hard to breathe. Pneumonia can develop as a result of poor lung inflation, not clearing your secretions, and not walking after surgery. You may develop a pneumothorax or a collapsed lung when your chest tube is removed and your lung hasn't healed completely. If this happens, your chest tube will be reinserted. Here is a list of possible complications immediately following surgery: irregular heart rate, low blood pressure, elevated blood sugar requiring insulin, blood clots, and kidney problems. Your condition and progress is carefully monitored while you are in the CVC ICU. Should any of these complications arise, you will be well cared for and these conditions treated.